Hello, and welcome to our presentation, Identifying Interprofessional Intervention Opportunities in the Clinic. I'm Dr. Lisa Milhan, and I got the opportunity to collaborate with Raina, Leckie and Rahma Osman to create what became the Interprofessional Intervention Opportunities Tool for Diabetes, or IIO tool for short. While discussing how to teach students about different professional roles and how to integrate these roles to improve patient outcomes, we determined a gap in knowledge between disciplines. The Unity Clinic is a way for student professionals to learn how to work as a team, but sparking the right conversations at the right time can be a challenge in a clinic environment. We want to facilitate the progression of learning into integrating knowledge into each profession's future practice. This challenge inspired the idea of creating a visual that students can use to promote collaborative patient care. We chose to focus on a single diagnosis and its symptoms. We picked diabetes because it is prevalent at the Unity Clinic. The decision tree module draft was the IIO tool 1.0, and it's come a long way. We work to be inclusive of all professions that intervene. Each discipline told us how they fit into the intervention of the symptoms of diabetes. Consistent with a person-centered team approach, we made the client an equal team member. The patient is the bright green bar. Students and faculty can use this tool while thinking through their treatment plan for the patient based on the patient's symptoms and quickly see all the other disciplines that they could collaborate with to optimize the treatment plan. This tool does not tell specifics about how each discipline treats. That is where the team communication comes in. This tool should help jumpstart the conversations and hardwire the utilization of multiple professions in future practice. To expose the students on interprofessional collaboration and the IIO tool, Rahma created an interactive D2L module based on our team's ideas and goals that went live for students in the spring 2022 Unity Clinic onboarding. An online quiz assesses the understanding of concepts, and we are working to integrate the IIO tool at Unity Clinic during clinic nights.
Our learning objectives for this module included the following listed on the slide. The module aims to provide students with knowledge and awareness on how each member of the healthcare team can be involved in helping the patient. In addition, it will also encourage students to recognize that the patient is also a team member and must be included in the decision-making process of a treatment plan, thus resulting in improved collaboration and communications between patients, providers, and all members of the healthcare team. While creating this module, we particularly focused on 2 IPE competencies, that is, teams and teamwork and roles and responsibilities. The goal of the module is to enable students to think beyond stereotypes of their current and future healthcare team members and allow them to see real-world examples that are within each profession's scope of practice. In turn, students can use those skills to not only optimize their delivery of care, but also foster effective and targeted communication. A key aspect of our module was to emphasize how interprofessional collaboration and teamwork can further contribute to providing patient-centered care. Through collaborating with the patient and involving them in the decision-making process, patients not only understand their health conditions better, but are also more likely to follow through with their treatment plan. The module also includes various interactive questions for students to complete, and an example of one of those activities is shown on this slide. In this activity, students are presented a scenario of a patient that has been recently diagnosed with diabetes. After reading the short case study, students are expected to click each profession and learn how that profession can be involved in helping address Sarah's symptoms. The goal of this activity is to highlight each profession's scope and how they may overlap or complement other professions.
Greetings, my name is Raina, and I'm here to introduce the Interprofessional Intervention Opportunities Tool, or the IIO tool, as we came to call it during our project. You can see the tool itself here on the right-hand side of the screen. The IPE Exploration module and the tool was developed around diabetes. However, in future projects, it could potentially be used with any diagnosis with just a few changes to the case study. This tool will provide patients as well as the practicing clinicians that are supervising in clinic a way to ask targeted questions to other disciplines specifically related to treating a particular diagnosis. It was meant to demonstrate the professional overlap in some treatment, and also how you can utilize other team members if one profession is not available at that time. The IIO tool lists the patient and the client at every symptom as a team member. This was very purposeful, and the point was to emphasize that the patient is intricately involved in their own treatment process. Here's an example of the team decision-making activity in the module itself, and it's just an example of one of the case that we present and an activity in getting them thinking differently about different professions. So the lessons learned from this IPE module that we created, well, we know that research shows that working in interdisciplinary teams improves healthcare and our patients' outcomes. Traditionally, this has been a challenge for students to learn how to collaborate with other healthcare team members while simultaneously learning the specifics of their own chosen profession and providing optimal patient care at the same time. So there was this need for a concrete tool, such as the one that we developed. This IIO tool will assist students and faculty in visualizing teamwork opportunities relating to a particular symptom or a diagnosis, and is meant to facilitate conversation as well as collaboration, core IPE values. During the creation of the tool, we learned that even faculty sometimes have difficulty identifying issues of clinical skill overlap and knowing where one starts and where one ends, therefore reinforcing our idea or belief there was a need for this high quality reference tool. Past healthcare culture has led to compartmentalization of disciplines in the healthcare team. So having a tool that both students and faculty can access is greatly helpful in promoting cultural change. So future steps for our module, we're going to fully integrate this IIO tool for diabetes team-based treatment at the Unity Clinic by providing access to the tool as part of the module, as well as recursive training on how to use the tool, connected with language that comes directly from the model. We'll collect feedback from the students on our tool, as well as our faculty, for the effectiveness and seeing how it potentially stimulates interprofessional collaboration. And then if that proves successful, we'll expand the use of the IIO tool for other common diagnoses treated by the students at the Unity Clinic.